This is an important one about if you were to get sick and need care, what is your plan and what would fund that plan if you needed long-term health care? Now, people always think of long-term health care, they think that's for old people in nursing homes. Couldn't be farther from the truth. Majority of people when they get sick and need care these days are really at younger ages. Almost a third of the people that get sick and need care are under the age of 65. Heart attacks, strokes, cancer, diabetes, all those different issues. And so the question becomes, if I was to get sick and need care, what are my options? Well, number one, obviously you could use cash. You could use cash in your own pocket. Unfortunately, it's an expensive proposition at $70,000, $80,000, $90,000 a year, but that's one option. Number two is Medicare. Medicare, for most people, is not really an option either because Medicare only covers a very short in duration care for home care and for nursing home care, so it's really not part of the plan for long-term health care. The third one would be Medicaid. The downside about Medicaid is, even though it's there, is you would have to basically be poor on paper, assets and income, to get qualification for Medicaid to pay the bill. Medicaid will pay nursing home care, but it's not really designed to cover home health care. So if you really want your independence, then we need to look at the funding options for long-term health care. Nowadays, there's really two. There is traditional long-term care insurance, where you pay for it as you go along, just like an automobile policy. If you get sick and need care, it will pay out benefits. And then the other type is the new program these days called hybrid long-term care policies that really come across in the last 5 to 10 years, where it's both a life insurance and a long-term care insurance policy all in one. So if you never need long-term health care, it's going to pay out a death benefit to your heirs. In the meantime, though, if you were to get sick and need care, it will pay the long-term health care expenses for home, assisted living, nursing home care. You can use the benefits wherever you want, and the premiums are also locked in to never go up during the duration of the policy. So the industry is really taking the challenge, and the newer products really meet some of those needs for long-term health care planning.